And welcome back. It's 1:10 in the afternoon. Thanks for being with us here on All Day Live. A recently formed doctors union at Allina Health is planning its first informational picket. It'll be tomorrow morning at 6 a.m. at 4 different Allina clinics in the Twin Cities. They represent primary care providers, and they've basically been negotiating a contract with Allina since February, and they say that things have stalled out, so they're going to have this informational picket tomorrow morning. Joining me now is physician assistant and union member Elizabeth Ezell of West St. Paul. Thanks so much for joining us, Elizabeth.
Thanks for having me.
So tell us about tomorrow. What are sort of the main concerns for your group?
Well, the main thing is we've been bargaining now. We've had 40 sessions. I am not part of the bargaining team, but I am following it. And we really haven't gotten very far. And we just want to let the public know that we are fighting for them and fighting for patient care.
Yeah, and go ahead. And I was going to ask you about that, the patient care piece, because I think people hear about, pickets or negotiations, and they think, well, this may be about salary. Do we need to be paying doctors more? But this really, you say, has to do with patient care. Can you kind of give me some examples?
Yes, exactly. So, first of all, I've been a provider for 31 years, and all at Allina. And really love what I do. I'm a primary care provider, so we call it PCP. So I have my own patient panel, and I see, a variety of patients. Through the years, we as providers, we used to be able to say what we, kind of how we ran our clinics and how much staff we had and who needed a little extra staff rooming patients because they had maybe shorter appointments or busier or longer appointments, whatever it was. But we had the power to choose our staffing. That has drastically changed. And now we have absolutely no power over that.
So you feel like you don't have any input at all in those situations?
None whatsoever. No, we do not. And that is actually one of the bargaining points that Allina is not agreeing to.
So let's break this down into an example that maybe some people can relate to. Things like, for instance, we all know that telehealth has become really, really big since COVID. How has that changed your job? And is that sort of what you're talking about here in the extra duties? Are you getting paid for that time? How does that work?
Yes, exactly. So nowadays there's telehealth. There's also medical messages, and obviously we still have the phone messages. So people will, we live in a society now that we just send a text quick and we expect a pretty quick response. And when I first started practicing, if you had a question for the doctor, you had to, I better make an appointment with my doctor because I have questions about my health. Now I'll just shoot my doctor a message and ask them about, what can I do for my constipation, or a variety of different things. Yeah. So those are things that we need to address, and we want to address our patients' needs, but many times that comes in between while we're already seeing patients in the clinic, and then that will come after hours, before hours. We spend a lot of time doing in basket, we call that in basket work.
In basket work. And about how much time would you say you're spending or a person might spend doing that kind of work and it sounds like you're saying not getting paid for it?
Right. We don't really get compensated for that. We do have an e-visit that we do get a little bit of money for, I guess. I'm not really sure what the exact dollar values are.
Sure.
But we do get compensated for that. But again, that is something that we have to do in between seeing our patients. I spend personally at least 1 to 2 hours every day.
A day.
Okay. Yeah.
Wow. Okay. It's just, good for people to, I think, for patients to understand, I guess, how you feel like this impacts them directly. Obviously, you guys are very, very concerned. The union itself, we talk about it. I remember when it first happened in 2023, the fall of 23, and I remember reading about it because it seemed rare to me. It's not something you hear about a lot in this country. A little bit more now in the last few years. But how did it come together? Was it easy? Did people jump on board and say yes, or what was it like, and how has it evolved in the last couple of years?
Well, me personally, I think it's come around because of the frustration of just our jobs changing and not being able to say anything about it. We just have to do it. So a lot of medical decisions are made, or a lot of practicing decisions are made, and they're not made by those practicing medicine. And they're not, oftentimes, I don't even think they're made by, accountants and different people. So, I mean, it is a business after all. But we got increasingly frustrated with not being able to have our needs met, basic needs. During the COVID, that's when a lot of things really hit ahead. And we started losing a lot of our staffing during that time. And since we are back seeing patients, we are now not allowed to have those pre-COVID staffing ratios. And, during COVID, we were happy to do our part and work hard. And we understood that this was a crisis. And now we're still working really hard, and that's not sustainable.
I see.
And we were really like, a lot of people are leaving medicine. A lot of people are leaving family practice in general because of a lot of the extra demands that are being placed on us. And we would like to preserve our future physicians, and really want to encourage people to come into this wonderful job of family practice.
Yeah, when I read, you can correct me if I'm wrong, but about 600 members in Minnesota, and then one clinic in River Falls, Wisconsin, as well. Is this something, just kind of digging into the union piece of this just a little bit more, is this something that you feel like could be replicated in other major cities? And does it threaten to sort of completely upend, the healthcare system as we know it?
Yes, well, I already know that there have been other cities and other doctors groups that are carefully watching this. It has been done actually on the East Coast. That's when we were first kind of deciding to become a union. That's where people came out and talked to us and told us kind of how it worked for them.
Okay. The last thing I want to ask you about as we kind of wrap up here, Elizabeth, is you talked about that obviously you're in this profession because you care about people, you want to take care of the patients. It also kind of occurs to me though, I mean, do you feel like you are taken care of as a caregiver as far as safety, workplace safety, staffing levels, perhaps even violence?
Right. That has become a big issue. So not usually, no. I don't feel like my work-life balance is being taken care of at all. I'm fortunate to not have any small young children, so I don't have to take a lot of sick leave, but we have a lot of doctors who do have young children, or, we work in a job where we can get sick. So if we take sick time, then if we take quite a bit of sick time, we only have a set amount of vacation time, and we don't have paid sick leave. So if we take a bunch of time off, or maybe even a surgery, then we have to not take vacation the rest of the year. So, or, say, oh, should I plan this trip later on in the year? Because what if I get a sick kid?
Sure.
And I can't go.
Okay. So. Just to remind folks, so four different informational pickets tomorrow. Again, it's not a strike. These are informational pickets. And it sounds like the union's asking people to join if they care to at those 4 locations. And you'll be in West St. Paul. And then there's Coon Rapids. I don't know if I have the other.
Maplewood.
And
Bloomington.
And Bloomington. Gotcha. Thank you for that. Yeah. Okay. Elizabeth, thank you so much for your time today. Really appreciate it.
Thank you. Thank you for having me.
Okay, you bet. All right, take care. And as we say goodbye to Elizabeth, I just want to read the statement from Allina based on what they know about the picket here. It says, Allina deeply values the dedication of our care team members who provide exceptional care to our patients and the communities we serve. There will be no disruption in care during these informational pickets. We continue to negotiate in good faith with Doctors Council, SEIU, and seek to reach responsible agreements that maintain competitive pay and benefits for our providers while ensuring that we can sustain our caring mission long term. At a time when we are facing significant uncertainty from rising costs, declining reimbursements, and potentially devastating cuts to critical programs like Medicaid, we remain focused on reaching agreements that ensure we can maintain access to the high quality care people depend on. And that is the statement from Allina.